This final discussion covers unique legal defenses and mental health conditions, particularly their relationship to violence, incarceration, and risk assessment. Post-traumatic stress disorder, PTSD, results from traumatic events and can serve as a defense in both violent and non-violent cases. While not necessarily more effective than other insanity-related defenses, PTSD may support claims of diminished responsibility, sometimes leading to reduced charges. It is often used in cases involving self-defense, particularly in battered woman syndrome. Dissociation exists on a spectrum from normal to pathological, with dissociative identity disorder, DID, being one of the most extreme manifestations. DID, formerly known as multiple personality disorder, involves two or more distinct personalities and recurrent memory loss. Similarly, dissociative amnesia involves partial or complete memory loss due to trauma, psychological factors, or neurophysiological disturbances. Memory loss can be localized, limited to specific events, or generalized, complete loss, though rare. Research shows that mental disorders alone do not necessarily predict violent behavior. However, schizophrenia is the most closely linked to violent crimes, though individuals with schizophrenia vary widely in their behaviors. Other key findings include: males with early-onset schizophrenia and antisocial tendencies are more likely to engage in persistent criminal activity. Violence is more strongly associated with a combination of serious mental illness and a history of violence. Common risk factors for crime, such as substance abuse, unemployment, and economic hardship, apply to both mentally disordered and non-disordered individuals. Mental illness alone is rarely the direct cause of criminal behavior. The MacArthur Research Network's classification system can help predict future violence among institutionalized patients. No single factor strongly predicts violence, rather, it results from a combination of individual risk factors. Many incarcerated individuals suffer from mental disorders, which can worsen due to prison conditions. Studies estimate that about half of U.S. inmates could benefit from psychological treatment, highlighting the intersection between the criminal justice system and mental health care. Threat assessment involves evaluating the likelihood and severity of potential violence based on warning signs, such as verbal or written threats. The landmark Tarasoff case established two key responsibilities for clinicians. 1. Duty to warn. Mental health professionals must actively warn potential victims of threats made by their clients. 2. Duty to protect. Clinicians must take reasonable steps to protect potential victims, though this does not necessarily require direct contact. This discussion underscores the complex relationship between mental disorders, criminal behavior, legal defenses, and risk assessment in both clinical and legal settings. By now you may think Mr. Rees is slightly touched. Be that as it may, he hopes these videos help you understand your reading a bit better. Once again, read your book.